Welcome back to the Morning Blend. You know, as we head into the fall season, it's important to take charge and take of your health, rather, with preventative measures.
Here to show us ways to avoid unnecessary stress and illness so you can get a clean bill of health, Dr. Justin Maxwell with Healthcare Partners Nevada. Great to see you.
You too.
Now, we are getting into the fall season, obviously. Is this the start of the flu season?
Yes, it is.
It is.
And it's very important that people are going into the clinics to get their vaccinations.
I think some people, they think, oh, wow, isn't it awfully early to be talking about that? Shouldn't be waiting until December. But really, if it's starting now, you get it now to help you through all those months as opposed to getting it as you're feeling sick.
Absolutely. It's all about prevention. And one of the things that I actually get a lot in my clinic is people will say, well, you know, I never get the flu. Why do I need a flu shot? Everything that we do is to prevent things from happening.
Yeah.
We don't know what's going to go on in the future, but we do our best.
It's important to maintain your health, your overall wellness year-round, not just during the fall and the winter when you think, oh, it's cold outside.
Yes, exactly.
Right? So what other things can we do today to prevent problems a little bit later on?
First thing is get in to see your doctor. It's very important. Some people need to see the doctor a little bit more frequently, 3-6 months, but at least get in annual and get in early, get in young. It's very important that we get a family history. Say you're a 25, 30-year-old male and you have extensive heart issues on the male side of the family. That's going to change how we screen or even how we treat. So it's very important. But the first step is that people need to get in to see the doctor.
No question. We know what health is, but we always hear health and wellness.
Yes.
What is wellness?
The wellness part is, just like you said, we think of the physical nature, but it's physical, social, and mental. So aside from the disease states, we have to think of what is our mental health. Anxiety and depression is on the rise. What are we doing for the anxiety? Are you meditating? Are you taking care of yourself? Or do you have a healthy diet? Are you exercising? And then social. Are you a part of some sort of organization, religious affiliation? It's very important that you, that people are engaged in the community.
And when you talk about going to see the doctor when you're young, it's important to get that baseline. And when you check for the baseline, what are you checking for?
Typically, we're checking routine blood work. Make sure you get the vaccinations. Vaccinations are very important. And then as you get older, there are screening studies, right? Your mammograms, your screening colonoscopies, your bone density scan as we get older. But at least the most important thing is to get in and get that family history so we know which way we need to dictate things.
No question. I know you have a total care model at Healthcare Partners Medical Group. Let's talk about what that means and how it's different than anything else you can see out there.
Well, first, it is the only one of its kind in Nevada, and I like to think of it as the VIP service of medicine without the high cost. We have a team of medical professionals that work together in a collaborative effort to provide high-quality health care. So we're calling patients. Do you need refills on your medications? Your appointment time is coming up. Some people need to get into specialists a lot sooner. So we're very good at organizing and coordinating this.
So if you have a doctor in your group, you're already doing these things for the patients. They may be aware of it, they may not be aware of it.
Yes, absolutely.
But it's going on behind the scenes.
There's a lot that goes on behind the scenes, yes.
No question.
And there are many doctors around the valley in your group that are specialists as well, so they can treat all kinds of diseases.
Absolutely, yes.
And the cool thing is when you're at those specialists, they don't have to retest you for the same stuff you've tested us for.
Yeah, because a lot of the information is in the computer system, so our communication, it's all about communication.
That's where a lot of the expense in healthcare is having to redo the same tests and redo the same clerical work, and you don't have to do that all the
Absolutely,
time.
it's that redundancy, the MRIs, the CAT scans, the labs, all that stuff adds up. Yes.
Now, open enrollment is coming up, Medicare open enrollment. Why is that so important, and what exactly is it for people who don't understand what it is?
So Medicare open enrollment does start this week. It goes from October 15th through December 7th. This is the only time where Medicare recipients can make these active changes in their health care plans, and these things can change. Medication formulas can change. Other details can change in their plan. So it's very important that people are revisiting their plans, and they can visit our website at www.hcpnv.com where they can find more information on this.
Yeah, I think some people just think, oh, well, the name of the plan's the same, therefore the plan is the same.
Exactly.
Not the case.
Not the case.
Yeah, if you are under one prescription, it may go away and it's in a different category, so then you have to make sure you're covered in that category for the medicine you want.
Exactly. It's the tier system, so you can go from a tier 1 to a tier 2 or 3, and that changes, and it all depends on what your specific needs are.
Yeah, we have a graphic up here of some healthy lifestyle tips. Can you go through these and tell us what we need to do?
Absolutely. Exercise regularly. I think that's intuitive.
Like,
at
how many
least,
days a week?
I would say at least 5 days a week. Make sure you're also doing some weight training with that, with your cardiovascular exercise. Eat a healthy diet as well. Manage stress. We need to be doing things. That's where your diet, your exercise, as well as meditation is a great form of
Yoga.
stress reduction. And stay positive, of course, and listen to your body.
Absolutely. Well,
good
I'm
tips.
listening to our producer. We have to go. It's great
Thank
having
you
you.
so
Thank
much.
you so much, buddy.
Thank you.
Medicare open enrollment starts this week on October 15th. Seniors 65 and older are encouraged to revisit their options during the time period that lasts through December 7th.
To learn more about Healthcare Partners Nevada, you can check out the information you see on your screen. Find Dr. Maxwell at their Fort Apache clinic, and maybe, just maybe, I'll be in the waiting room waiting before you.
You never know. Now get